Okay, welcome everybody to today's webinar presented by the Institute for Health Technology Transformation and DynTek, and featuring Kim Singletary, Director Technical Solution Marketing with McAfee, Paul Doucette, Senior Technical Security Engineer with Berkshire Health Systems, and Brian Zeno, District Manager with DynTek. My name is Matthew Rayner, and I am the Senior Marketing Manager here at the Institute for Health Technology Transformation. I would like to thank everyone for attending today's webinar, the very first IHG Squared webinar of 2013. Here at IHG Squared, we strive to provide programs such as today's webinar that drive innovation, educate, and provide a critical understanding of how technology applications, solutions, and devices can improve the quality, safety, and efficiency of healthcare. We encourage you to visit our website at www.ihealthtran.com to learn more. As a reminder, today's webinar will be recorded and made available for download along with the PowerPoint slides on the Institute's website. Once again, that URL, www.ihealthtran.com, by close of business today. We will also be hosting a brief question and answer session at the conclusion of today's presentation. So please feel free to send in your questions at any point during the webinar today by using the question section on your GoToWebinar toolbar. I would like to take a quick moment and give everyone a better background of our presenters for today's webinar, starting with Kim Singletary. Kim is the Director Technical Solution Marketing for McAfee. As mentioned, Kim has 15 years of product management and marketing experience with companies specializing in outsourced IT services and SaaS for healthcare. Her broad technical expertise also covers business aspects, sustainable compliance, security management, and how technology, mobility, data are changing work environments. Next, Paul Doucette. Paul is the Senior Technical Security Engineer for Berkshire Health Systems, where he has worked for 15 years. Paul has extensive experience evaluating, implementing, and supporting security solutions that align to Berkshire's compliance requirements and business objectives. He has been a McAfee customer for over 15 years. And finally, Brian Zeno. Brian is the District Manager for DynTek, a leading systems integrator and McAfee's Government, Health, and Education Partner of the Year in 2011 and 2012. Brian has over 20 years of experience in the IT industry with a strong focus in helping healthcare organizations like Berkshire's envision and deploy IT solutions. At this time, I would like to turn things over to Kim Singletary from McAfee. Kim?
Thank you. So to get going, I want to give everybody a little bit of an agenda of what we're going to cover today, which will be on the next slide. And I kind of use some terms here that talk about the strategy for industry defensive. And I'm really considering this very much like if you had a organized team, whether it be, I wish hockey, but not, baseball, basketball, or whatnot. There's certain things you do on the defensive side of the team. And so right now it's kind of similar in healthcare. There's some areas that can use a lot of improvement, and people are just not paying attention to and not looking at some of the technologies that could really help them just get better compliance, get more efficient at what they need to do. And so the three defenses that we put down that we're going to talk about in today's webinar really talk about the risk assessment, which to my mind is really understanding your playing field. Depending on what, as an organization, your objectives are in terms of providing health care, your size of your company, and of course, a lot of it's your resources that you have available is going to determine quite a bit about what you'll be able to do for security, what you need to do for creating the quality care your organization needs to continue to provide. And the key aspect about HIPAA, it always starts with the risk assessment, understanding where your gaps are, understanding where things are going. And I think some of the big lessons that we've been learning from the results of the recent audits through ONC is that risk assessment needs to happen more than just once. It needs to be a program. It needs to have continuous possibilities that if a large change happens in your organization, it's probably time to do another risk assessment. It may be smaller in scope, maybe not as comprehensive, but it needs to have that process in there. So once you understand the playing field, now you need to know what kind of gear do I need for the game. If I'm playing hockey, if I'm playing basketball, two different types of equipment out there. So really looking at what is it that your organization does, where the weakness is, and in my mind, one of the key aspects we're going to cover today is just providing better endpoint protection. I think more than 75% of the issues that are publicly aware on the wall of shame come down to endpoint protection issues. If better protection was put in place, a lot of those breaches would not have occurred. So to me, that's a huge defensive move, being able to put something down, to have it manageable, to have it available when you need it, is a key aspect in not hindering the business by any means. And so we're going to be able to talk about that today. And the last one is really looking at the security management. I think the days are gone where we can think having malware protection or an endpoint protection solution and a firewall are going to do it. It's just not. There's too many moving parts. There's too many bad actors out there. And even though healthcare hasn't been hit with a lot of quote-unquote cybercrime from hackers, there have been a few examples, it's still having that management because we know it's going to come. There's just too much rich data there, especially if you're an organization that does research, especially if you're larger too, because there's just so much value in medical data records, like Ponemon would say, and there's a whole bunch of studies out there that actually talk to the cost of that. So really the management, if you're going to relate it to the game analysis that I'm using today, is really talking about constantly looking over the tapes, looking over the games. What went well in that game? What didn't go well in that game? What kind of plays can we do again? What should we be watching for? And really setting what I would consider the trends. What are the trends that you're seeing? What's normal out there, and how can you go beyond that to provide even more protection? So with that, let's get to the meat of the webinar and get to the next slide. And so with that, we're talking about doing something that had a little bit of a strategy out there. And we wanted to cover, I think a lot of people who attend this webinar today have your own motivation. But part of my job is kind of collecting and having the feel for the industry trends. And so I thought there was some really key trends that are happening very early for 2013 is that Health and Human Services finds the first organization for a breach that was under 500 records. And this is information because it means that size doesn't matter anymore. Everybody is going to be held accountable to provide the security of the healthcare records that their organization processes, holds, and transmits. And with that in mind, it gets it. I kind of look at it as a learning opportunity. You now will have some idea of what the cost is. This happened to be one stolen laptop cost that organization $50,000, plus you have to add on top of that what the state notification breach actions would be for that state too. So many times it's a year of credit monitoring for those records that were in jeopardy, and any PR and marketing they may need to do because of the slump in their business, attributed to this bad public information. So with that, we look at some other trends is, obviously the risk assessment would have picked up that it's really great to look at endpoint protection, especially anything that leaves the organization, but also things that are within the organization. It's very easy in small practices, small businesses, very distributed organizations and hospitals to have endpoints that you don't always have eyes on at all times. And it's much better just to protect them to be on the safeguard. So some good practices here, and this came from an information security Today study that is part of the ISMG Media Group. And they basically said to their populace, how often should you do a risk assessment? And 9% said whenever a major change occurs, and I absolutely agree. I think that that's one of the key recommendations we're going to hear about today. But what really kind of surprised me is that 23% said every 2 to 3 years. There's just so many things that are changing in these environments that I just feel that's really a long time, and that we probably should be doing these assessments a little bit more often and look about what kind of scope you can have for those assessments so that you can do maybe a smaller in scope more often to accommodate that change. So on the next slide, some industry stats here that we talked about. We're going to talk about kind of the new strategy. I think the reality is everybody's been breached. The key here is how do you minimize the risk? How do you react to it faster? The prevention as a goal is not realistic. Again, Paniman here is saying that 94% of all health organizations suffered at least one data breach. When you dig into that, and I think that's been around, what really surprised me is that 45% of those same organizations experienced 5 during the same time period. So it's not that you're just being breached, it's that you're totally being exploited during that time frame. And how can you do better about not only notifying that you've had a breach, but making sure that it does not get worse, it does not continue to perpetuate, and that you don't have something in your organization that might open the door for many, many more over that time period. So some of the tools we're going to look at in security management is really how to change the strategy to understand about creating a rapid response system. That's more of the reality. Doing security management that's going to identify the normal, identify risky behavior, and it's going to try to look at where do I need to spend my next dollar to prevent and control what makes sense. It'd be great. We could be the best team out there. You could be the best healthcare organization out there if you had unlimited budget and unlimited resources. And today, that is just not the reality. According to the Chime study for 2000, just look at my notes, for 2012, 60% of those executives in that organization are having IT staffing shortages. So this is something that you need to look at. How can I use these tools? How can I get something that's going to be a right fit for my organization, for the right resources, and not continue to create more and more dashboards to look at, to create more and more training that I need to get my IT staff to do, but they're already swamped already. How do we get more efficient in all of this? And that's really what we're going to look at when we get into the actual tools and some of the benefits they provide. Because we know that a lot of customers out there, there's a lot of tools out there. You have choices, which is great, but how do you make these choices so that they are really better for your organization and not just reactive and saying, oh, I have a gap here, I need this tool, and that I'm going to go and get that, but then don't realize the long-term ROI of that tool may just not be that valuable in the end. And the bottom line, too, is reality. Again, I like understanding this industry, is that there's not a defined security budget year after year for 57% of your organizations out there that are in healthcare. And so it's really hard to say, I need this for this project because I have to justify it. I have to go to a board and say, this is what we need based on our risk assessment or based on this issue that we had. We really want to justify that. It's much easier when you're in a large enterprise, which is McAfee sells to quite a bit, and they know they have running budget year after year. And we know in healthcare that's not the case. And so part of the effort in going out to market with this is understanding that and providing some information that's going to make your decisions easier, make sure that it fits for your organization. So if you move to the next slide, we're going to jump into talking about what is a good security risk assessment and how you should, some tips and tricks that you should use going forward. So take it away.
Thank you, Kim. I'd like to thank everybody again for joining the webinar today. My name is Brian Zeno. As Matt had mentioned, I'm the New England manager for DynTek, based here out of the Boston area. My background is 20-plus years in the IT arena, with everything from managing the consulting side of the business and a lot of focus on actually running CIO-type operations. So have been able to work on both sides of the fence and understand the issues that come up on the business side of the operations. So wanted to also take a little bit of time and just explain who DynTek is. DynTek is a nationwide solution provider with a few main focuses. We're a Cisco Gold partner focusing on the networking side of the arena. We're a Microsoft Gold partner focusing on server infrastructure side of the house with all of the different Microsoft tools at your hands there. Very heavy in the virtualization market space. And we're a McAfee Elite partner with a large presence on the security offerings that Kim's been speaking about here, with security kind of being an underlying arch that we do within all of our practices. DynTek has been around for about 23 years, nationwide provider with headquartered out of California with offices across the country with a strong presence on the West Coast and East Coast both. And as Matt had mentioned in the beginning, we were the McAfee Healthcare Partner of the Year for the last 2 years running. So I wanted to take a little bit of time and just talk about security assessments in general. We saw a big need a little over a year ago with the big push around meaningful use stage 1 for a lot of our healthcare customers in particular to really get their arms around what's out there in their environment. It was surprising from the perspective of getting into the healthcare agencies via everybody from the smaller community health centers all the way up, that a lot of them really didn't understand their posture of their environment, or in a lot of cases they felt that they had a good handle on things, that they had tools in place, the people and processes in place. So what we really did was come up with an assessment really based around, in this particular case, around meaningful use stage 1 to hit the big areas to make sure people understood where they really stood within as they were going through their risk assessment. And out of that, we would go in and look at detailed assessments around their vulnerabilities within their environment using some industry tools that I'll talk about in a second. But we didn't focus just solely on the technology and on the vulnerabilities per se in the environment. We also take a look at working with the staff on just controls in general, looking at their policies and procedures, to do a review with them just to make sure that they understood what they needed, get a feel for a lot of them thought they might have stuff in place or thought that they were good enough policies, and as you reviewed them and talked through things with them, found out that that may have not necessarily been the case. And then through our whole findings, the big important part was to really come back with a good summary outline so that you can really understand where you stand, because these things, as you know, in general are daunting doing when you're looking at big risk management assessments. And with this piece kind of just giving you some insight on, the technical security side, even then there's a lot of data that comes back at you, so it can be overwhelming to even assess that information. So we like to come back and be able to give you some good executive summary around the findings and the areas that you really want to focus on. Matt, go ahead and jump to the next slide here. So some of the main areas that we focus in on the physical side within these is looking at things around the facility access controls. This is probably the one area I would say that for the most part everybody has a pretty good handle on. Everybody understands the physical controls, knows what they need to do with their data centers, and really had a pretty good handle in that area. So that was the one area I would say across the board we run into that I was always happy to see that people don't really have an issue with. But I still find it, where I find the biggest faults in this area that I think people really need to take a good look at when they're doing their assessments is a lot of times the focus is still meant more on the data center as a whole, and the outlying remote facilities, data closets, things of that nature get overlooked and are obviously big threats, where if it's not a big deal, someone can't get into your data center, but yet they can walk right into a data closet and close the door and get access to your entire network from that point. So even though in general that was probably the biggest area that we find people had no issues with, it's still a big area that I think gets overlooked and needs to be continually reviewed. A lot of look goes into the device and media controls, things around antivirus protection, how people are using a lot of times one of the biggest pet peeves I run into out there when I'm looking at things is, first of all, it actually amazes me, mainly in the what I would call the mid-tier environments, but really see it across the board, is most everybody figures they have antivirus in place, but a lot of them still aren't actually using the overall management modules. They're just putting out their AV controls and kind of hoping or assuming that updates are happening and that everything is good because we have AV. So we really like to make sure that people are using an antivirus product that has management capabilities at a top level, and that most importantly they're then using both that pane of glass, as Kim had mentioned earlier, to look at, but make sure it's set up correctly, and getting the alerts and whatnot, so that you don't have to have someone dedicated staring at it all the time, but when things do happen in the environment, the correct people are being notified of the breaches. And that one really surprised me, how many times you go in and find that they have AV technically in place, but they have a lot of issues flying around in their environment because the time isn't really being spent to making sure that they put the system in and just kind of assume it's all well, and it does. It's like anything. I use the analogy of a car. You can buy a new car, but you still got to check the oil and change the oil and whatnot every once in a while, and not just run it into the ground. The other big piece that we look at is encryption. This is particularly within healthcare, like Kim mentioned, is the focus around meaningful use has been on what they call data in motion, mainly focusing on making sure your products are encrypted, that are mobile devices, notebooks, tablets, things of that nature. And in our audits, we find still a surprising percentage of facilities that don't have encryption, or they're partially encrypted. And the other surprising thing, getting back much to the AV scenario, is I find it very important where it's people that are using encryption, no matter what product they're using. Some of them are just using products that have no management capabilities. So they say their notebooks are encrypted with some product, but they have no means whatsoever to know exactly what's going on out there in the environment. So I think it's critical that if you're going to dive into this area, which you really have to, make sure that you're using an encryption product that once again is managed at a top level so that you can truly see that your devices are there, that they're encrypted, and then in the event that you are breached, that you have an easy, absolute accurate way to be able to show the security team that, okay, no problem, that device was stolen, lost, whatever it might be, but it was encrypted, here's the proof of it, boom, and from a controls perspective, you're covered then. And then the last piece we look at from a physical perspective is the disposal policy, another area that people still really struggle with, how to get rid of all of these devices as they move them out and making sure that they get rid of the data in the proper way. It's still an amazing thing out there that people either just literally just throw the stuff out in the garbage or in a pile and have someone pick it up and not make sure that the actual data itself is being disposed of in a proper way. So it's really important to make sure your policies are in place on that, and we'll talk about that a little bit. Before we jump to the next slide, the other thing I just wanted to talk about was kind of now talk about what we've done in general and the tool, what we recommend that you do as you're looking into some security assessments. From a technical perspective, we run vulnerability management tools when we go into customer sites, and a lot of you, I'm sure, also for the larger agencies might already have the vulnerability assessment tools. That's the first thing we go in and run is this tool, and what it does is looks at basically anything with an IP address. It comes back and will tell us all of the known vulnerabilities that it found on the devices, via networking devices. If the iOS level, if there's known issues with the iOSs you're running on them, that people can penetrate and get into breach your systems. Firmware on printers has become a big issue over the last year and a half. Has gotten a lot of press around stuff like that. This will notify you of your printers. Focus a lot on the desktops, particularly around third-party patching, which is an area I'll talk about in a second that really people still don't seem to have a really good handle on, that I think needs to be really looked at. And then it also will even look at things of natures like, okay, you have wireless access points, you have routers. making sure that your security is enabled on those devices, that you're not using the default passwords from the factories. It'll notify you of stuff like that. In the assessments, it's amazing. These reports are absolutely outstanding and can really stifle a security group, in my opinion. They run the tool and you get 10,000 pages back, and it can be really overwhelming. But we find it a really interesting tool to give people a good understanding of their posture. We find a lot of places think that they have a good handle on their vulnerabilities in their environment. They say, "Oh, I got WSUS installed, and we put patches out." But yet, when we run these tools, we find an amazing amount of just Microsoft patches that are not covered in the enterprise, solely because, once again, they deploy a product and they're just doing what the install did, and it's just putting out base patches that Microsoft say are the most critical, but no one's looking into making sure all the patches are applied and doing regular research to see what's going on out there. And then the other area that we're really seeing nobody tackle is the third-party patching. I've seen a lot more progress in this area in the last 6 months to 9 months maybe, but people have solely been focusing, when they do patching, on the operating system level and not looking at the level of the third parties, which is where most of the attacks do come in nowadays around the phishing schemes and the Adobe, all the issues within like your Adobe readers and whatnot. So I really recommend to people that they take a hard look within their patching scenarios and make sure that their base patching is being done correctly, and then going all the way up into third-party patching. Matt, go ahead and jump to the next slide. This is just a real brief list of some of the main policies and controls that we feel are important. And once again, these were mainly focused around the minimal stuff for meaningful use dollars. And what we do, and we feel it's good for every environment, every business to do this, is found in a lot of places. Generally, these things still tend to roll up, a lot of times into the CFO area. And everybody thinks they have a good handle on it. We have the policies documented. We handle everything. But when we sit down and actually have them go through the policies, and just really it's really a self-assessment from the perspective of, in our case, we just kind of do a guided self-assessment with you to ask some questions and go through some things. And we find a high percentage of people kind of changing their minds where they thought they had a good control over their policies. They had their policies deployed, that they were up to date, and then most important, actively being enforced out in the environment. And as you ask through the questions, we find that that's not always the case, and it kind of gets people to realize, back to something Kim had mentioned early on, about the need to continually, it's not just do it once, put it in the book, send them out to your users and check it off on the list. It's really, really important to make sure that your policies and procedures are working. And so a couple of them that I'll point out to here that I find, are like around the sanction policy, which is, that's just simply meaning that when your employees are found doing something they shouldn't be doing, how are they, what are the reprimands, and are they being followed? We find a lot of times they're there, but no one actually ever goes through and lets the employees know, this is what happens the first time, second time, third time, and then actually make sure that the policies are followed. The other big one I find, and I have a lot of experience with this even on the, not only in healthcare, but in my life, I'm more on the SOC side of the house, is the termination procedures. No matter what industry I look into and have worked with, it's a very daunting process between HR and IT working closely together with terminations to making sure that access is turned off and that the policy and procedures are followed quickly. It's, in today's age, it's, until it happens, which I can say I have seen it happen in action, of people not following the processes, and because the manager's not realizing that the policy and the process is there for a reason. I've seen literally people, as they're getting terminated at their desk, sitting at their PC, deleting the world off their PC while their manager's getting rid of them. And all because they're not following the process. And it just can bring in a huge amount of heartache for a company, and when you're trying to find information later on. And then I'll jump toward the bottom here. The disaster recovery plan is still another area that I find people either don't have or are good at documenting, but then that's probably one of the most important ones to actually go through, and you need to run through your disaster recovery plan and make sure it works. Once again, I had experience in this area where I spent time as a CIO out in Hawaii where we had a major earthquake and thought we had a great disaster recovery process and plan, and overall it worked pretty well. But until we actually had a disaster and had to run through it, and the whole island's out of electricity and everything else is cut off, we found 2 or 3 good gaping issues in our plan around employee notification, bringing systems down and back up in a reasonable time, that until it happened to us, we just didn't realize. And so it's important to run through these disasters, try to do simulations, and most importantly, if it ever does happen to you, review what happened and make changes to your plan. You know, don't be proud enough to say, oh, I don't need to change anything. So hopefully this is just ideas for you to be thinking around what to do with assessments as part of your risk mitigation to figure out what's going on, and hopefully was able to point out to you some good ideas to look into. I'd like to now cut over and welcome Paul Doucette from Berkshire Health Systems. As mentioned in the beginning, Paul's been a long-standing customer working with both us here at DynTek as well as a long-term McAfee client, and has been with Berkshire for a very long time. So I'd like to introduce Paul and kind of cut it over to him. And Matt, you can go to the next slide here. So Paul, welcome. I was just wondering if you'd take a minute and introduce yourself to the group a little bit and talk a little bit about what Berkshire Health Systems does and how your business works.
Sure can. Thanks, Brian. Hi, I'm Paul Doucette from Berkshire Health Systems. We are a Western Massachusetts healthcare organization. We have 3 hospitals. 2 of them are inpatient. Our main medical center holds around 300 beds. Our South County has 25 beds. And our other one is for V&A and long-term care staffing. In addition to our healthcare, our main EMR is Meditech, and we also just recently incorporated Allscripts for our outside practices. We have a very large long-term care and also mobile V&A and a lot of nursing home sites affiliated with us. Workstations, we're getting close up to around 4,000 right now. Employees are growing. You know, we're growing more and more every day. You know, it seems to me when we added our mobile workforce, you know, the iPads, the laptops, the phones, it's just booming. You know, and it's never ending.
So Paul, can you talk a little bit about some of the challenges that you're really seeing out there from the security side of things that you're kind of, I don't want to say struggling with, but that you're tackling and just really seeing challenges around complying with within the healthcare arena?
Yep, the biggest was HIPAA, Massachusetts state laws, CMR 17, you know, encrypting our devices, making sure that, you know, the bring your own device day, that, you know, how we're going to manage all these people. You know, it's amazing how they all come in once you enable all this, from cell phones to iPads and mobile laptops. You know, we needed a good way to protect this patient data that's going to be, you know, potentially seen on all these mobile devices, and making sure they're locked and encrypted.
Great. And what type of security programs are you currently working on, looking at deploying?
So all our mobile devices utilize the McAfee encryption, file encryption. So those are all, every device that passes through our hands or gets deployed initiates a full disk encryption.
Great. Matt, do you want to jump to the next slide here? I'm not. So I want to jump back over to Kim now.
I could talk a little bit about this. The first thing we had to do was identify what data was where, and all these devices, we had no idea what was on people's laptops or people's cell phones, and so initially we installed McAfee's host data loss prevention to at least put in a log mode, and it was really eye-opening to find out what people were putting on drives and what people were putting on flash drives, and saving external and bringing in hard drives, and it was really shocker. Once we were able to get a lot of this information logged and identified, we were able to structure rules around that so they could either block it, encrypt it, or let it go. But it was tough at first, but once once we were able to see all that data, it helped out huge. We're able to also create evidence logs for our legal staff. So if something does happen, they can create a nice evidence log. Legal team can take care of it from there.
Well, sounds like you're just validating some of the things I threw out. Could you talk a little bit about your use with EPO and a management council, and how useful you guys have found that, and having everything kind of roll up into one central area?
Yep, been an EPO customer since its invention, I guess. It changes every year, and every year more and more third-party or outside parties is then plugged into it. So now I have a central management console that controls 15, 20 different applications of protection. Everything's seen in one single management. Big help, for the help desk staff and technicians.
Great. Next slide, Matt. Okay. So can you talk a little bit also about how you go about from a staffing perspective? Is it just yourself handling this, or you're the team that you have to handle all these things with 4,000 nodes out there doing all this?
Yep. So desktop technicians, they have their big hand in part of the encryption part. They're the ones that are out there encrypting the devices, and the staff is around 15 technicians. They're all fully aware of EPO and how it works, enabling encryption. As far as DLP goes, it's a little bit more limited. Some of the legal staff and the privacy office were able to utilize that as well.
Great. Well, thank you very much for your information there. I think we're jumping over to Kim now, I believe. Next slide.
Great.
Yep, we'll turn over to Kim now.
Thank you. So it's interesting. So from an EPO perspective, you're able to have a dashboard that gives you some of the things that Brian talked about, of understanding, do I have my endpoint protection in place? What's the status of it? From the example of, do I have the most recent update? You can also force an update. But one of the key aspects from McAfee, and this is a fairly new product to our portfolio, is to be able to go beyond just managing the endpoint, but giving you much, much wider visibility within the environment. And we acquired a technology from Nitro, which is what we're really calling the next generation SIM, or security management capability. Again, it is integrated in EPO, but it has its own dashboard because it has a lot more dials and widgets, but gives you the ability to not only look at what's happening from traditional SIM tools, and that's what we see here on the screen, is looking at the promise of SIM, which you're able to take data, which is basically the log data, the outputs, this constant flow that's going in and out of your organization, put some filters on it, and actually come out with actionable data, actionable information, and eventually with key risk indicators and everything else, actually be able to save money or know where your next dollar should be spent, because you're seeing your own gaps. You're making your own local intelligence based on how you're using these systems, what you need from an organization, and what kind of compliance standards you need to adhere to. So if you go to the next slide, we're going to look at some of this technology, and this is going to build out, but really the challenge. You know, it's hard enough, I tell you, being in IT for so long, it just gets more and more complex year after year after year, and in any way that you can take all of this data that's out there. I mean, SIM first started from looking at what's happening on the firewall and then what's happening in your intrusion detection and then your intrusion protection systems. And it just keeps layering up and up and up. And it's interesting because one of the key values about what we're now calling is the McAfee ESM, or Enterprise Security Management tool, is that we're able to now manage and do this in a very timely manner and be able to start having some sense about this big security data challenge, being able to pull in all of those logs from your traditional, which is the lowest perimeter, to your compliance logs. We can pull in application logs. We can pull in application logs, and we actually have an agreement with Fair Warning from a authorized record access management tool of being able to pull the logs from Fair Warning into the SIM and be able to write reports and monitor based on that. We can also pull in reports from access management from facilities. So if you have a digital key card system, identity management system for log on and log off, we can pull all of that in, so you get more than just your standard IT context. You can start putting more and more data, more and more context into this without a huge cost. And I think that's the big thing. Healthcare, I think, in the past has strayed away from really building out this contextual security because it's expensive. Notoriously, any of the other competitors out there, you're going to say it's going to take a database, it's going to take a database administrator to do this. I have enough databases running around alone. I just don't have the bandwidth to deal with this. One of the nice things that this has a built-in database, you do not need a DBA, and we also have a very slow, very small, I should say it's very fast, but a very small deployment in a virtual machine too. So it's very dynamic and very helpful for healthcare, and you can actually grow this to a much, much bigger system. The key here, though, is that we can process these literally almost billions of events, or events per second, very, very rapidly, so that you can start seeing, bottom line, what's normal in your organization, and give you that ability to do the historical reporting, audit, and compliance with not a lot of overhead, being able to really get down to that and understand that. So if you go to the next slide, you can look at some of the benefits that you have today. And we talked about being able to put things into context and being able to understand your threats, whether it's from, do I have the most recent antivirus on these systems? What do I need to do from that? Here, you're now able to really trend out and start building your own key risk indicators. I also like to think about this. If you know your key risk indicators, you're almost building a real-time breach notification tool, because you can come in here and look at all of these events. You can say, and you can actually say, have I been communicating with bad actors? I actually met a health IT administrator out of the Texas area, and he was going to retire. He basically said the last 10 years, every day, consistently, without fail, he would get a ping from China. They blocked it, they were monitoring it, but it kept him up at night. His favorite, he's like, I know this is, I'm going to still worry about it even after I retire. And, he knew that this was happening. It was a story that he told me in confidence, but one of these things is that this global threat intelligence that we have from McAfee, we actually are able to go in and take a look at and know this from all of the connections we have and integrate it to GTI. So we can see if there's bad actors. We can also make sure that we can report and see, was it blocked? Were there controls in place to already block it? Which accounts were compromised? And what occurred in those accounts? So if we really think about looking at from a HIPAA compliance perspective and being able to understand breach notification, if you enable this with these additional controls of the physical system building, the logging of your clinical applications and the access controls, you can really get a pretty good digital picture of where that data is being touched, who's touching it, and where it's going in your organization. If you go to the next slide, we can really talk about how we integrate. And I think this is showing, oh, it's not showing it, but we're really looking at integrating this with EPO. So you have a single dash that you can collect from EPO, and you manage your data sources. All of the McAfee products today, the Virus Scan Enterprise and App Control and everything else, can actually feed into EPO also. So again, being able to have that, it's not a legal log, but be able to have basically the evidence that says I'm doing a report and I have the control in place, even though we've had this breach, we've minimized it because we have controls in these local areas. And so here's where I really need to go take quick action because we may have an open area we need to address. But also from an assessment perspective, it helps you if you have these kind of reports, these dashboards created with your key risk indicators. You can do your own self-assessment of how am I doing based on risk out there? What do I have? What's going on? And that really helps in the long run to get ahead and get much more efficient in how you utilize your resources. If you want to go to the next slide, we're going to talk about here, you can see one of the key aspects is that Gartner actually named this technology, now it's the Enterprise Security Manager, but in the visionary section, the upper right quadrant where we always want to be. And I think the aspect here and the call to action after this, that if you're thinking about SIM or you want to understand more, is that definitely contact DynTek, take a look at it and see if you get a pilot or proof of concept going to understand how this might help in your organizations. We have identified healthcare because of basically the issue about spend. It's so hard to get a project going and to get the ROI for it and everything else that we're seeing a lot of customers really see a great return with this technology, being able to justify it through compliance and have the compliance reporting, but also justify in some of the trends that they're seeing about breach notification and building this into part of their process. Like Brian talked about, it is a process. Your whole compliance is a process, but building a tool like this into the process of being able to do ongoing assessments and ongoing notifications for anything that might happen. And if you go to the next slide, we have some information if you'd like more about this product and also some other details in terms of customers and some data sheets and everything out there about this basically newer technology. We're the first ones to have this basically in-memory capability of being able to monitor all of this. What I didn't show here, and I wish I did, but it basically, once you point it to your log systems, a dashboard comes up, and from that dashboard, you can easily say, well, I want to match my data that I have here, that my logs, my firewalls, and my endpoints, and match that against and see if anything flags as susceptible based on what McAfee's GTI threat feed looks like. And immediately you can see from the dashboard if any of the situations based on bad IP address, bad content, URLs, things like that, if there's any matches. So you can go back and take a look at that right off the bat and make sure that that's valuable information. You can react to those very quickly and make sure they don't become a larger issue. The other thing too from a breach perspective is you can go in and what's nice about this, it has an ability to monitor the flows in and out of databases. So one of the key aspects is understanding your database, but privileged users. I know it's hard to say this, but I mean, making sure that when you set up your policies and procedures that your privileged users are doing what they should be doing and having some way of monitoring that. A lot of times you don't, and now you'll be able to have a tool. There's nothing that you actually need to do to the database. It sits on the network, and you'll be able to actually, there's drop-down reports, and one of the reports says, hey, based on HIPAA, I want to know what my privileged database users are doing. So you can see the times they logged in, the times they logged out. And even though they're not taking a forbidden action or a out-of-policy action, you may start to refine your policies. For example, you may see a database administrator take action on a Saturday afternoon at 2 o'clock when their time card or your login from their time management system says, I don't have any open tuple tickets at that time, or there's not a workflow assigned to the database at that time. Why is the administrator in there? So there's ways to get more sophisticated, more mature in the IT model to be able to provide kind of learning experiences to see what's happening that you normally wouldn't have that kind of visibility to. So with that, I wanted to open this up to anybody out there and to Matt to ask for questions for any of the panelists today.
Thank you, Kim. And once again, I would like to remind everyone that today's webinar recording and the PowerPoint presentation will be available on the Institute for Health Technology Transformation's website. Once again, that URL, www.ihealthtran.com, by close of business today. As mentioned, we would now like to open up the presentation to answering your questions. As a reminder, to submit a question, please click on the Questions tab on your GoToWebinar toolbar and simply type in your question in the provided chat box. Our first question from our audience, if I'm monitoring the access from the clinical applications, why would I need a SIEM or security management?
I guess I'll take that. So one of the things is that, yeah, I mean, accessing the authorized access to records from the clinical application is very important. It's one of the key aspects about HIPAA is making sure that you only have, based on your role and your responsibility, access to those records, and any anomalies should definitely be reported and managed. But it doesn't give you the comprehensive view of everything going on in your environment. It is important, and one of the aspects about the huge influx of, in the last 5 years, implementing and standing up these electronic and digitized health systems is that they're not all logging in the same manner. And so, I do predict that it is a key component, but it's probably better to have a broader access also on who's doing what. You can get down to more granular information of not only are they accessing it, but it's been a trend over time, not that they just have one access, but they've had several, I would say, questionable or break the glass situations, and why does that happen, and to help manage that policy. And so I think one of the things, at least the McAfee product, has the ability easily to look at those logs, but look at several other factors that also go into that. How long, what did they access, where did they access, and see if any other anomaly behaviors happening at the same time. I think it's just a much richer view, and also as there's other aspects about making sure that you are having breach notification, not just access who's accessing the records, but as I kind of predicted before, the healthcare industry has gotten off easy so far from what I would call true cyber criminals. And I think it's just a matter of time before you'll see more and more actual, cyber attacks from, the digital aspect and getting into these applications. Like Brian was saying, these third-party applications are great, unfortunately, vectors to compromise and to get into these systems to get that valuable data. So I think it's just going to be, we've been on a kind of a honeymoon period, and I think there will be, unfortunately, more of those predictable in the future. And having this kind of tool will give you that faster notification to those situations.
Excellent, thank you. Our next question, can you elaborate on the differences between other SIEMs and McAfee's ESM?
Okay, I guess that's for me again. So one of the key aspects from the enterprise security management that McAfee has compared to other SIEMs, it's speed. It is speed. It's the ability to easily go back and do a trending report historically on things that happened in the past and get a response in a matter of minutes, even if it's a huge environment, maybe an hour versus days. There is not an Oracle database behind this. This technology actually came from the industrial labs, and it is based on transactions. So it can handle all these transactions. It can handle multiple queries. And also, I think the dashboard, having the dashboard and having the integration to the McAfee Global Threat Intelligence and integrating with all of the other McAfee products in terms of logging and capability just gives you a much richer start to begin with at a much lower cost point, because to integrate that kind of information in the traditional vendors would take a lot of professional services or internal training and know-how to do that. And so we're giving you much broader benefit right out of the box.
Hey, this is Brian Gantroff with DynTek. I'm the Managing Director of our National Security Practice. And I just wanted to elaborate on that just a little bit. So what a lot of other SIM vendors do, because they are relying on traditional database technologies like, it could be SQL, it could be Oracle, it could be a lot of different things. But one of the things that, when you start working with the different consulting organizations that implement them do is they start parsing the data out and purging a lot of the data before it ever makes its way into the database. So a lot of times when you're looking at, you're trying to look at something that happened last week or, a few weeks ago or even today, and you're trying to find out what happened on your network when you're doing correlation, it's kind of like you're looking for a needle in the haystack, except they've told you to throw away 80 to 90% of that haystack because they said that detail wasn't important. So it becomes impossible to actually do true correlation because you don't have a complete set of data at that point. So that was just one thing I wanted to mention. And it is because, McAfee ESM loves big data because of that proprietary database format. And then also, another thing that, I've seen as a huge benefit to organizations is, being in the IT side of things from time to time in my career, every once in a while you get that call from somebody that says, hey, what happened on the network yesterday? At 3:15 p.m., we're hearing that something happened. You have no idea what happened. So what do you do traditionally, right? You started going through logs, or, if you have a SIM, you started trying to, find out if something was going on yesterday at 3:15, but it was a very slow process with traditional SIMs where the queries can take, sometimes hours. And with Nitro, or Enterprise Security Manager from McAfee, finding out what happened yesterday at 3:15 p.m., it's something you can do in real time. And I like to correlate that to, imagine using Google if when you asked Google a question, it gave you a response hours or days later. Google wouldn't be around today. And that's essentially what a lot of legacy SIMs give you, is that type of performance where some of these queries can literally take hours to days, even longer depending on how much data is in that database. So I just wanted to throw those couple of things out there as an elaboration. Thanks.
Thank you. And unfortunately, that is all the time we have for today's presentation. I would like to thank everyone for joining us, and once again to our presenters for today's fantastic webinar. One final reminder for those interested, please visit www.ihealthtran.com to download today's recorded webinar and PowerPoint slides. Those will be added by close of business today. With that said, we wish everyone a fantastic day, and we look forward to connecting again in the future. Thank you.